Today's presentation is by Enever, who's from Mundarian Wellness Centre, and you're a naturopath.
Yeah.
So I'll hand straight over. Thank you.
All right. Hi everyone, how are we? I see people all day long, and the first thing I always ask them is, "Oh, can you go and change the I do it every single day though, like to dozens of people every day, and it's just like, I'll just have it. So my name is Eddie. I am a naturopath. I own the Mammalian Brain Centre. We've got 15 different practitioners there, a yoga hall, a cafe, and it's quite a sort of little hub in the hills there. So I am very passionate about teaching people about their health. So I do a lot of health lecturing. I actually lecture at some of the natural medicine colleges as well. So I teach people, or I teach students nutritional medicine, herbal medicine, things like that, and helping them in their student clinic. So I'm really passionate. I believe it's the real key to improving your health is to improve your knowledge, basically. That's that whole biblical sort of quote, teach how to fish instead of keep the fish. And I very strongly believe in the way that I practice is to empower people with as much knowledge as possible. And that's my ultimate goal. So that's me. That's not actually me. That got put onto Facebook. Somebody cut and pasted my face onto a very old school prom photo, I think it was, and popped up on Facebook to millions of people. So thank you, whoever that was in England. So this is my personal mission statement, is to educate, empower and inspire as many people as possible to live happier, healthier lives. So I also have another company called Digestion, which is a global health education, online health education company, which we do a lot of online education, trying to raise people's level of knowledge up about health and wellness and what it actually is to be healthy and well. All online, so you can get really high quality health education for very minimal cost. That's one of my other passions there. So I've got a lot of colleagues that work with me, so doctors, other nutritionists, different sorts of physical therapists, all presenting what they're passionate about. So, but today, what I'm going to talk about is fibromyalgia, and I see this a lot, and it seems to be more and more people are presenting with fibro. I really enjoy treating fibro because I can get really good results with it. I actually don't think it's that hard to treat when we look at it from a holistic perspective, which is what we're going to talk about today. So forgetting about the diagnosis and treating the person, that's what I do. I don't believe in diagnoses or whatever name you want to call it, fibromyalgia, polymyalgia, rheumatica, rheumatoid arthritis, whatever the name is. I don't take a huge amount of notice of it. What I do is I treat the person in front of me, whether that's Jill or Joe or Bob or whatever it might be, and look at what's going on for the whole person. And by treating the whole person and all the different facets of what health is, which we'll talk about in a second, I get really good results. And I think it's important to take that approach to fibro because it's such a multifaceted sort of condition. So today I'm going to talk to you about, from a naturopathic holistic perspective, about fibro. Now you probably know lots of happening with it, and you've probably done lots of research, so some of it might be new, some of it you may have already heard of. Feel free to ask questions. I really like it when we can bounce off each other and talk ahead. I'm going to present what I see commonly with basically every fibro patient I've ever treated. I see a triad of symptoms. So 3 things that's always common. I won't say 100% because there's always the one that throws, the hairy one that comes in. Then there might be other things stacked up on top of that triad, which we'll talk about towards the end. But I'm going to go through the triad of symptoms, I call them, or conditions that I see with fibro. So we're going to look at those other factors possibly involved in disease progression, and also treatment options from a naturopathic point of view, so what natural medicine has to offer, if you're interested. So my disclaimer is that all the information, this is my opinion from my clinical experience, my research, my own education, and anything that I present is just really general in nature. Like I said, to be able to treat someone effectively, you need to know the ins and outs of what their body's doing. So it doesn't take the replace any orthodox medical advice. So me just covering my bum basically. So does that sort of sum it up a little bit?
Yep.
Yeah. Frustrating. So everything hurts. Nobody knows why, and nobody takes me seriously. So I think this really sums fibro from my perspective from a holistic point of view, that fibro is very much like a mosaic with its many little different pieces that make up the disease picture. So you can take little bits away, and you can work on yourself, but the disease picture doesn't really go away, because in a big mosaic like that with lots and lots of factors that are influencing the health, you can take lots of pieces away, but the general picture is still there. You can still see the disease picture. So my way of treating is to look at the body and look at for as many pieces of the puzzle what's contributing to this person's disease, and trying to remove the obstacles to healing. So the big roadblocks in the way. So the more of these stones that we can remove from the mosaic, the better that person feels. If we can get a lot of these stones out of the way, then it starts to not really look like fibro anymore. And this isn't just specific to fibro, a lot of chronic diseases are in the same boat. So I also like to think about health in a little bit different way as well. There's a phenomenal medical physician, so a medical doctor in Switzerland that I follow has worked very, very closely. You may have heard of him through your Googling and research, Dr. Thomas Rowell at the Paracelsus Clinic.
He's very good with lines.
Yeah, he's very good with a lot of things. He's a phenomenal physician if you can afford to see him. He owns the Paracelsus Clinic in Switzerland. It's a living clinic. You stay in there for 2 and 4 week stays. You get the works done to you, and it's very holistic. He's a medical doctor, but in Europe, the medical profession and the natural profession is very interrelated, very different to Australia. And you stay in there and he goes through the work. So he has this really good analogy that I use a lot of the disease barrel. So he says, and his work's online too, if you YouTube him, you can see a lot of his lectures. He's really good to watch. And he always talks about the disease barrel. So if you imagine that when you were born with a 44-gallon drum or a barrel inside you, and it's relatively empty. You may have filled it up with a few little things from another, maybe some heavy metals from toxic exposure, things like that. But as you live your life, you start to pile things in. So it might be some uncleared viruses, some nutrient deficiencies, more toxins from pollution and dental amalgam, things like that. And it starts to fill up. And as it fills up and up and up and up, it's still feeling, but you're really feeling okay. There's not too much in the way of symptoms going on. But then it starts to overflow. When it starts to overflow, that's when the symptoms start to arise. So his theory, and why he's so phenomenally good at treating chronic disease, is that he looks at what went into that barrel, and that's what he treats. He treats everything that went in there. You just can't find the one cure, the magic pill. I love to be able to say, use that herb or use this vitamin and everything's going to go away, but it just doesn't work like that. And so he looks at what goes in, so it's toxicity, and it's all lots of things that he starts to take out a couple at a time until it gets down below that, the barrel's lip again. And that's where you start to get some symptom relief, and you just start to chip away at it. And Thomas Rowell's got a phenomenal success rate in fibro. He's got an 80% success rate in around about 6 weeks. Phenomenal. He's a doctor, he can actually say, I can cure things. He cures 80% of MS patients that go to his clinic. Now, it doesn't happen overnight, but it happens in a 1 to 2 year period. I think it goes through a lot of cleansing of the body, but very, very, very good stuff. And I like the analogy because with chronic disease, a lot of things go in when I look at this. So my question is, what is health? Does anyone want to have a crack at what health is?
Not being ill. Not being ill.
Yes, it's a good one.
It's more than the absence of disease.
Yeah. It's pretty multifaceted health. A lot of people consider health just being physical health, and it's so much more than that. So you've got lots of facets or aspects of health, and it really is the interaction between all of these and finding that balance. And you've got physical, emotional, mental, social, financial, spiritual, sexual, the whole lot. Now, financials, I know a lot of people sort of look at you weirdly when it's like finance. It's like, does finances have an impact on your emotional health?
Yes.
Big time. And does that emotional health have an impact on your physical health?
Yes.
Big time. So it's important to look at all these, and that's when you go to a holistic practitioner, that's when, for myself, when people sit down, I look at all these different aspects of, what's out of balance? There's always a payoff. If you just ignore your eggs in one basket, where's the payoff? So it's about highlighting that and finding out how we need to balance things as well. So that's, to me, what health and wellness is. It's making sure all your different aspects is balanced. Another big one is that disease only grows in unhealthy soil. I lecture a lot, and I always talk about people's soil. So it's really bodily conditions. A lot of people like to blame the body. There's something wrong with my body, and people come to me daily and I say, look, there's nothing wrong with your body. It's doing the best it can with the conditions that are provided for it. Maybe those conditions aren't, too
Do you
flashy.
include that when there are genetic causes? I mean,
Genetics is a
pre-existing-
little bit trickier, and a lot of people do, and quite often I get people say, oh, what about a 2-year-old that gets leukemia? How is that? But not necessarily their soil. Their soil may be compromised. You see high heavy metal, things like mercury toxicity, that isn't necessarily the child's heavy metals, it's the mother's. They get passed
Well, I'm
through the placenta,
talking
so-
more about inheritable
Yeah,
connective tissue
that's a little bit
disease.
trickier, and that is part of the soil. That's the cards that have sort of been dealt in that respect, so you've got to work with that. But other aspects that affect your soil are things like your diet, your stress levels. There's lots of things we're going to have a look at what can affect the soil as well today. So this is the triad that I see very commonly. So I don't know if you've all been tested for vitamin D. Has everyone been tested for vitamin D?
Yeah.
You should. It's always low. You should always low. 1 in 3 Australians are insufficient in vitamin D. Makes no sense whatsoever. We're in Australia with all the sun. Why are we deficient in
Because we've
vitamin
been
D?
told to stay out of the sun.
What's that?
We've been told to stay out of the sun, and that's why.
Slack plays a part of it. It's a very complex chain of events that happens with vitamin D. It takes about 4 days to be activated in your body. And there's lots of factors. If you carry a little bit too much body weight, the UVB rays from the sun won't penetrate and convert to vitamin D. If you've got liver problems, it can interfere with it. If you've got kidney problems, it can interfere with it. Cholesterol medication can interfere with it. There's lots of factors. It's quite...
Is there something about fibromyalgia that stops you absorbing it? Because I just take huge doses and I'm
Yep.
still not had it.
Yep. Gut health.
I read a theory that said that the start of fibro is actually started initially in the gut with gut disturbances leading to a leaky gut, and then you didn't get absorption of vitamin D, and iron apparently is another one.
It is, any inflammation of the intestinal mucosa, the intestinal lining, you don't tolerate or you don't absorb your fat-soluble vitamins well at all. So that's A, D, and K. So it doesn't matter if you have a little bit of bloating up to IBS, Crohn's, the whole spectrum. Any degree of inflammation, your fat-soluble nutrients compromise the absorption of them. So you say that, and commonly see people with the digestive system fibros are pretty average. So those two sort of go hand in hand. Like you said, the leaky gut, that's just a byproduct of inflammation. When things swell. If you imagine your intestines are a tube running through, that tube's basically impenetrable unless your body wants to drag something through. If that tube starts to swell up, inflamed, it swells up, starts to get gappy. This allows bacterial toxins, very minute, microscopic, polydigested food, proteins and peptides into the body, and the immune system can react against that and cause like a autoimmune sort of type inflammation response, so that lodge in tissues and cause inflammation. So low vitamin D, poor gut health, chronic stress I've always seen. So we're going to have a look at each one of these in a little bit of detail. So vitamin D, very, very, very important. Every single one of your cells in your body, all 100 trillion of them, are people with vitamin D receptors. We know about that much of what vitamin D is used for in the body. We know it's good for bones, everyone knows that. But it's even more important for things like your immune system and how balanced your immune system is. So whether you go allergy, whether that's hay fever, eczema, asthma, or whether that's autoimmune conditions, so all allergies, just the spectrum of allergy, it helps to almost predispose you to that if you're very low. And I treat people down as low as 10, 12 nanomoles per litre, which is really low. My patients, I get them up to 150 nanomoles per litre. I believe that's where the optimal level is when you've got chronic issues. So I work very closely with a lot of medical doctors, and we work on getting them up as soon as we can. And with vitamin D2, there's what's called a genetic polymorphism. It's a genetic variant that 1 in 4 people are born with. So some of you will have it. And with that gene variant, you don't absorb vitamin D well at all in the gut. You've got less receptors to suck it in. So 1 in 4 people, so 25% of the population, that's pretty big. So those people are called double doses. So you need to go bucket loads of vitamin D to get it up orally. And you see that's really common with 1 in 4.
So what level do you think? How high do you go?
For vitamin D?
Yes. How high a dose do you take?
Well, it depends on how low you are. So, Vitamin D being a fat-soluble vitamin, you store that in your body. It's like iron. You don't just take iron for the sake of taking iron. You take vitamin D to build your levels up to where they need to be, or optimal, which I believe is 150 nanomole per litre. Once you're there, you can chop it on the head. You don't need to have it anymore. You don't need to monitor it to make sure it doesn't dip right down. There's another factor, boron deficiency, which is quite common in WA, which doesn't let you activate vitamin D in your kidneys. So that could be a factor as well. But if you're very, very low, it might be really high doses. I had someone in the other day who she's a cancer patient of mine, and I got her to get her vitamin D levels checked because I knew they were going to be low, breast cancer patient. And I don't actually know what her level was, but the doctor's jaw dropped and said, your vitamin D levels are in your toes, they're that low. So he gave her 50,000 international units a week, one capsule a week, got made up through it. So that's 50 capsules of vitamin D once a week to get her up.
I at the moment take 150,000
You do?
a week, once a week.
Yeah, yeah.
And mine's still, it's come up from 8 to 50.
I take
Boron
100
could be
and
your
something,
issue.
I take 16,000 a day.
Yeah, yeah.
It's still low.
Yeah, could be a boron. One of my little things here, because the way that vitamin D works is that your UVB rays penetrate your skin. There's a cholesterol precursor in there that starts to get altered over about a 3-day period. From there it goes to your liver. In your liver it gets chemically transformed a bit, still inactive, doesn't do anything. Then it goes to your kidneys, and that's where all the good stuff happens, and it gets activated, and that's where boron's absolutely essential. It's a lock and key model. It has to have boron to work. So that could be a problem too. So the roles of vitamin D, you've probably seen this, it's a natural anti-prolific, it's a natural anti-cancer compound. Stops things growing uncontrollably. A lot of research out there for different sorts of cancer like melanoma, colon, prostate, breast cancer. Melanoma we hide from the sun, we hide from vitamin D, so we don't get melanoma, but it's the one thing that actually helps protect us from it. So it's a bit strange there. We know it's good for the bone, blood clotting is important, and for the immune system. So, symptoms, these ones here are pretty familiar to you, I'm sure. Muscle pain, weakness, bone and joint pain, chronic pain. That's why I always see it low. So, as soon as someone comes with fibro, the first things we look for, digestive, vitamin D, and the history of chronic stress, and then we look at, well, what else is on top of that? So, really important to have a look at that. And that's that point about boron. Got there a bit quicker than I thought, but really, really important boron. Not a lot known about boron. It's quite a new thing, but it's very, very important. So it might be worthwhile looking into. Now, the third thing that I say is really high history of chronic stress. So a long, long history of trauma, whether that be abuse or sexual abuse or whatever, just a lifetime of trauma after trauma. I see it really commonly. I don't know if any of it rings true, but stress is a normal thing. We all undergo stress. The fight or flight response is something that's in us to help us rise up to the challenge. But sometimes if we've got that fight or flight response always going, we end up with chronic persistent stress, and that's really bad. It wears the body down. So we're going to have a look at that because that's a really important factor. So the stress response, a few things happen in the stress response. So when, imagine walking down the road and a saber-toothed tiger jumps out, what are you going to do? You're going to fight or run like hell. So to do that, your body's got to gear up to that challenge. So there's a few changes that happen in the body. Your central nervous system, your brain basically switches, overfunction a little bit, which we'll look at, and your adrenal glands kick in. So usually in the brain, you operate from this little yellow area, which is your frontal lobe. So that's all about your motor function, learning, planning, reasoning, impulse control, memory. Really important. So that's where you usually operate from. But when you're stressed, you go to this little yellow area called the mammalian brain, or the limbic system. It's a very old part of the brain, very primitive part through evolution, and that's all about one thing only, that's survival. So it gears your body up. So when you're stressed, you lose all this sort of stuff. You don't remember what to do, you don't remember what's on your chores, those sorts of things. Impulse control, that's a big one. Emotional eating is a big factor in emotional eating. You lose your ability to control your impulses, so whether that's food, ciggies, alcohol, gambling, whatever it might be, it's a big factor in it. That's why there's that big emotional component to addictions. So all of this stuff gets affected. So in your kidneys as well, you've got your adrenal glands up the top. I'm sure you probably know what they are. Does everyone know what your adrenal glands are? So they produce adrenalines. So they produce stress hormones like adrenaline and cortisol. Cortisol's, you've probably read a lot about too, and this is a big factor in what's going on in the fibromyalgia patient, cortisol issues. Because cortisol is just a massive spanner in the works. It just interferes with all your hormonal pathways, your reproductive cycle, your menstrual cycle goes all haywire, your thyroid function decreases, which makes you put on more weight, has issues, your gastrointestinal system gets knocked out, which we'll have a look in a second. So, what sort of stresses are there? Pain? Yeah. Financial? Yeah, there's bucket loads. You've got your physical stresses, your mental, emotional, social, spiritual, financial, that's a big one. Occupational, environmental, what could that be? Pollution. Occupational, crap job, maybe you don't enjoy your job or your people you work with.
Noise levels from environment.
Yeah.
Noise.
EMF's another one, electromagnetic frequency, dirty electricity. In Australia, not a huge amount of airplay. It doesn't get much airplay, but in Europe, they're huge on EMF. The influence it has on human health, it's massive. Now, it doesn't matter what your stress is. It could be your financial stress, your EMF, your lack of sleep, your too much exercise, whatever it might be. But it does not matter. The fight or flight response still gets kicked in. Okay? So it doesn't matter. Your body doesn't look at that stress being different. That stress is just, we're challenged, we need to rise up to it. So that's all well and good in the acute sort of form, very short term, but in the long term, it's bad. We'll see why. So the stress doesn't even need to happen as well. That's a really important point. You can just think about it. So walking down the road and you see someone walking in front of you that vaguely looks like your ex-partner that you can't stand. Same sort of haircut, same build, same height. Your blood pressure goes up, bang, you're in fight or flight. That's taking its toll on the body. And you keep doing that, and you live in survival mode, constantly in survival mode, which a lot of people do, it wears your body down. Okay? So it has a massive impact. All these different areas get affected. Your adrenal health is really important. And it's because of this little cortisol hormone. So everyone uses cortisol. Had tablets and it's made you feel pretty good. No? Not all of you. Usually it gives a bit of a response, but not always. So your cortisol is your natural anti-inflammatory hormone. When you're very, very low on it, things flare up. How can your body douse the flames of inflammation without something to do with it? It's really, really important. So usually on a normal day you produce about 20 milligrams of it, but when you're stressed, you produce 10 times that amount, 200 milligrams. So if you do that for decades, you think your adrenal glands are going to be okay with that? They're not. They get exhausted. They get really, really tired. And then you get very low levels of cortisol. And I always see that in my fibro patients too. So cortisol being very low. You can test this stuff. Salivary hormone testing is one of the best ways.
Is this what they call adrenal fatigue?
Yeah, there's a whole spectrum of stage 1, 2 and 3 adrenal issues. So it ends with basically exhaustion, I suppose, which is, you start going into chronic fatigue syndrome. Then I believe the next step from that's really fibro. It's chronic fatigue that everything hurts. And then after that it gets even worse, and that's where you start to see the bad stuff come up. The cancers and things like that. So cortisol is really important, really, really important. It's got lots of roles, but the main one is anti-inflammatory. So it's about getting cortisol levels up too. It's really, really important. So you asked about the adrenals and the different levels of it. So in the acute response, they rise to the challenge and they do pretty well at that. But you keep pounding them, and 200 milligrams of cortisol every a few times a day for a couple of decades, and they get really, really exhausted and fatigued. So you end up in stage 3 adrenal exhaustion. So you get very low DHEA, which is a hormone again produced by adrenal glands. It's a master hormone or compound, and the cortisol gets really low. And your ability to cope with stress also gets really low too. So you just have this sort of vicious cycle, perpetuating cycle of really chronic stress levels. And it explains a lot of the musculoskeletal symptoms too. So some of the adrenal-related health issues: chronic fatigue syndrome, got fibro, a lot of inflammatory conditions, and almost all other health issues that have a stress component to it. Now, the biggest thing that I see with stress and the influence that it actually has on the human body, and I see it daily, and it's so much I lecture about it constantly. My students hate me because I just constantly talk to them about it, because I just see it every day. It's so common, is the influence it has on your digestive system. So has everyone got some sort of digestive issues going on with them? Right? It's really common. So the biggest consequences is this top point here, hypo or hyperchlorhydria. That just means how much stomach acid you've got in your tummy. So it's supposed to be really high. Your stomach's got a pH of about 1.5 to 2.5. That's really strong. It's hydrochloric acid. Battery acid, it's got a pH of 1. So a drop of your stomach acid on this table will sickle through it. It's that strong. It's got to be digest meats and nuts and seeds and plants and all those sorts of things. Now when you're stressed, 99.9% of the time, your stomach acid goes very low. Every now and again, you get someone who gets the high, but the symptoms are almost identical. So you go to your GP, usually you get classified as your hyperacidic person, you get an antacid. But in my experience, it's almost always low. My whole career, I've treated probably 2 people in the hyper classification, and the rest of them, which is bucket loads, in the hypo, not enough stomach acid. Because the knock-on impact of that is lots of fermentation in the gut. So if you go back, your food goes into your tummy, it's semi-solid, you chew it a little bit, most people don't chew enough, but it goes into the stomach semi-solid where it sits there for a while and gets mushed up by the acid, and it's supposed to make it into a really fine liquid called chyme. That fine liquid is still acidic in nature and it exits the stomach into the small intestine. As soon as it exits, there's lots of hormonal receptors through here which send hormones all around the body. So it sends a hormone to the liver and it says, get ready, food's coming, we're going to need bile. So produce some more bile. It'll send a hormone to your gallbladder, say squeeze, we need to absorb fat, so get that bile into the digestive system so we can emulsify the fats and suck it in to be used. It sends a hormone to your pancreas, it says producing bicarbonates. And bicarbonates is how your intestines get alkaline. Because your stomach's got a pH of 1.5, super acidic, but your intestines have a pH of around about 8.4, somewhere like that. So really alkaline. What I find is when you get low stomach acid here, you get the opposite in the intestines. You start to get acidic intestines, which means they start to flare up. When they flare up, they start to get gappy, and they get leaky, and some naturopath might call it leaky gut. I don't like that term, but basically is what it is. Very microscopic, don't think holes like that big or anything like that. But it sets you up for a lot of problems. So you've got a lot of inflammation going on. So you get fermentation, all those bugs in your digestive tract. You've got 100 trillion bacteria in your digestive system, really important for your health. But when the conditions get out of whack, the pH is the biggest factor for their health. The pH starts to drop in the intestines and start to ferment things. The byproduct of fermentation is gas. So you've got 22 foot of intestine in here, so it depends on where the fermentation's happen. It might be wind if it's right down the bottom, it might be up high bloating or reflux or indigestion if it's up high, or it might be in the middle and it's just trapped and it's gripey and it's just a nice feeling. But you get lots of fermentation. The other byproduct, there's 2 other byproducts of this fermentation. There's lactic acid production. These bacteria might take probiotics, they're called lactobacillus bacteria. The lactic acid producing bacteria, that's why they're called that. If they start to get a little bit overactive, they start to produce too much acid, and it compounds the acidity in the intestine and compounds the inflammation. And you also get alcohol produced, so the byproduct of fermentation is alcohol. So that leaches back through your leaky gut into the bloodstream to your liver where it gets burdened, so your liver has to then deal with that. It's already working hard over time, but it gets stressed a little bit more. So that's the byproduct of that, and I see that every day. Hypochlorhydria, low stomach acid. That can also lead on to bacterial problems, like a bit of overgrowth and bugs in the wrong spots, and it might lead to yeasty issues or all sorts of things like that. Or it might actually slow things down or speed things up, constipation, diarrhea. Any inflammation in the digestive tract, you're not going to absorb the nutrition as best you could. I'll always say to people, the best diet in the world is not worth a pinch of salt if you can't break it down and absorb it into your body. So you can spend your hundreds of dollars on supplements and biodynamic organic food, but if you're not breaking it down and absorbing it, you've got expensive feces that's going straight through you. Not straight through you, you'll absorb some of it, but it's not doing the best for you. It can weaken your immune system. Did you know 85% of your immune system is inside your intestines? The last 2 foot of your intestines, you've got a huge amount of lymphatic system there. It's called the gastrointestinal associated lymphoid tissue, which is lymphatic system in there. And 85% is huge. So if you've got unhappy digestion, you get an unhappy immune system. And that can overreact. Somebody talked about leaky gut, things entering the body and the immune system attacking it. That can happen through all this. Sets you up with an inflammatory condition. Very commonly, poor wake and sleep cycles. Now, a lot of fibro people don't sleep well. Does anyone here sleep well? Do you know, what's your sleepy hormone? Do you know what it's called? Melatonin. Do you know how melatonin is produced in the body? From serotonin. Do you know where 95% of that serotonin is produced? In your belly. So you always say people with digestive issues with poor sleep, wake and sleep cycles. So the key to getting them back on top of their sleep issues is to fix the gut. And the key to fixing the gut, in my opinion, is the pHs. So get good strong stomach acid. Here's my picture. A nice alkaline intestines.
Sorry, how do you detect whether it's bipolar or hyperphagia?
There's no real actual test. Like you could probably get a blood, but failing that, it's all done on symptoms. So when you go to your GP, typically you're going to, you say, I'm getting bloating, high up, bit of reflux, burps, whatever it might be, and usually your doctor will 99% of the time say you're hyperacidic. Too much stomach acid, here take Somac, Nexium, Pariet, Mylantal, whatever it might be. I completely disagree. From my experience, I do the opposite. Do something to make you get more stomach acid. You know, by age 50, you've got 15% of your stomach acid that you had at age 25. It drops that dramatically. You put stress on top of that, you got nothing. You get old, every year over 50 gets lower and lower every single year. So it's a natural part of aging. So you've got to support your digestion as you age anyway. But you put stress and pain stress and the whole stress of just having fibro, that knocks your stomach acid out as well. It's a big part of the picture, so it's important to establish good pH, and I believe 99.9% of people out there have lower levels of stomach acid than what they should have. So antacids aren't the way. Antacids help with the symptoms a little bit, but usually you've still got symptoms. And the knock-on side effects of antacids, I think, are pretty severe. So we don't absorb your nutrition. You know antacids knock your stomach acid out by 99%. They're supposed to be used for 2 weeks and 2 weeks only. I treat people that have been on 10, 15 years, 20 years sometimes. So it's not, physiologically you're supposed to have a pH of 1.5 to 2.5. You're supposed to have hydrochloric acid, basic battery acid in your stomach. It's designed that way. So as long as if you've got good stomach acid there and you've got nice alkaline intestines, the balance comes in. A lot of people take products for their health. I don't even use products hardly ever in my clinic. I work with the pHs. When the pH is right, your bacteria is happy. It's not about just getting in health plus and stick another 20 billion in there. You've already got 100 trillion, work with those ones and make them happy. Your bugs are your best assets. Do you know your bugs in your body outweigh you 10 times? So you're only 10% human, believe it or not. So you're made up of about 100 trillion cells. You've got about 10 times whatever that number is, 10 times 100 trillion. That's how many bacteria you've got in and on you. It's important to work with them, not against them. When they're happy, they can help you to be happy. So we've gone through that. Does that all make sense? Any of that not make sense? So, some of the things that we see in digestive. Major stress, and all this stuff here. Again, I don't believe in diagnosis, but these symptoms that are all in here will be very much what you guys and girls are suffering with. Okay. That's what I said before. Done that. Sorry, I got a bit ahead of myself, got excited, sorry. I love talking about this only because I just see it every day. 15% of the hydrochloric acid you had at 25. It's very, very dramatic. So as you age, support digestive system somehow. So, just finishing up, I'm pretty much done with the triads side of things. The disease barrel, again, a lot more things can go in than just the triad. It's not just about looking at the triad. Sometimes the triad works for people. You resolve those issues and they're good. But sometimes there's other things that have gone into that disease barrel. They can be all these sorts of things. So just poor nutrition in general, which can over-acidify the body and cause pain, acid pain. So the acid-alkaline balance, which I'm sure you've probably come across. As your intestinal mucosa, the lining of the intestines get weaker and weaker, or thinner and thinner as they get inflamed, you get more sensitive and you can develop food allergies or intolerances down here somewhere. So it's important to look at those and just give the digestive system a bit of a break for a while to heal back up. The lining of your intestinal tract is brand new within around about 2 weeks. So going on these hypoallergenic style diets, like the GAPS diet and other ones that are out there, are a good idea while you're working on your digestive system to bring it up back to health. That can be a factor. Chronic organic and inorganic toxic burdens. So these are things like the plastics that you might eat from or microwave with, or if you drink from a plastic water bottle, or these BPA and these other, these chemicals that get into the food chain. The reality is we live in a pretty toxic world, and we need to arm ourselves against it and try to take the best precautions we can. So instead of using a plastic water bottle, get yourself a stainless steel one or a glass one or something like that. Because all these things, they go into the barrel and it might just cause things to overflow. You also have your heavy metals. Very commonly see these in fibro, mainly mercury. So where do you get mercury from? One of the biggest ones, teeth. Biggest one's your teeth, unfortunately. You can get that out of the body. Things like zeolites, or you can even do intravenous. My medical doctor colleague does a lot of intravenous work with heavy metals, but you've got to get the source out. And I know dental work's pretty expensive, so I actually recommend my patients, if they need extensive dental work, is to go overseas and get it done. Get it done really cheaply. Places like Thailand, although a lot of people go to Thailand, get a tattoo there or anything like that, but you've got some fabulous German biological dentists in Thailand that do phenomenal work, and you can get a whole mouth done for the price of like one tooth over there. Unfortunately, it's taken the trade out of the country, but it's a lot of money you can save, and it's an important part. And especially also, there's another one in here somewhere, infective dental foci. So basically what that is, it's a little point of infection in your gums. Could be a root canal tooth that you had many, many years ago. Root canals are very hard to do properly and to clean it all out. So what happens is that it heals over and it forms a little focal point of infection that just festers away and it leaches toxins into the body. And that can be a big factor when it comes to chronic health. Dental health affects your systemic health.
Doesn't that show up in the X-ray?
No, you've got to have what's called a 3D tomography scan of it, which can show it up. So it's a slightly different sort of scan, but yeah, root canals can sometimes be a big issue. I've treated a few people with some pretty gross stuff in their gangrenous material and stuff. I had no idea it was there though. No idea. And we got it done because I had chronic persistent sinusitis. That's the top tooth. There's one membrane, you've got sinuses, you've got your teeth, and you just couldn't shift it for years and years and years. And I knew there was something going on with the teeth. So we got the scan done, got the tooth taken out, and it was all gangrenous material in it. It's disgusting, you reckon? And that'd been there for years, just festering away, leaching into the body. So that can play a factor as well. So take dental health really seriously. We've already talked about the chronic stress. Too much pharmaceutical medication over a long, long period can also help fill the barrel up, especially things like non-steroidal anti-inflammatories, ibuprofen, so Nurofen, things like that. The impact that they have on your digestive system is pretty severe. We know gut health is really important. You have things like cell wall deficient bacteria, so Mycoplasma, Brucella, even Borealis, things like Borealis, Lyme's, which is on the rise. Very similar disease, similar picture of disease. So lots of things can go into that, and that's what, when you work with a health professional that looks at health a little bit differently like that, is looking at what's gone in. I always say to people, I get cancer patients in, I say, there's nothing wrong with your body, it's doing the best it can. Let's find out what the roadblocks are and look and dig deep and see what's there. Do the heavy metals, see what's going on. Oh, I've got bucket loads of heavy metals going on, let's start to get rid of them. Let's give the body, let's find the source, get rid of that and get rid of what's residual in the body. And start getting that mosaic picture and taking some of those little bits out as much as we can until that picture just doesn't look like fibro anymore. That can take a while.
With the heavy metals, though, you can't get rid of it, can you?
Heavy metals out, there's lots of options for heavy metals. You can do it orally, slow process, you want to do it very, very slowly, so 1 to 2 years. Detox is a way of life, don't stuff on TV, 48-hour detox and 7-day detox, it's all a load of bollocks. It's just a marketing ploy selling you for the weight loss side of things. It won't liberate any toxic metals from your body at all. You've got to get in there with some pretty specific compounds. They can go intravenous with all sorts of different stuff, which my doctor friend does, or myself, I do it all orally, so I use things like zeolites and things that can actually bind up your heavy metals and start to get rid of them. It takes a while though. It's a way of life. It really is. It's like when you go, if you ever go see Thomas Rao in the Paracelsus clinic, he said, I will fix you, but it can take 1 to 2 years. I don't think it's going to take 1 bottle or 2 months or anything like that.
So how do the heavy metals show up in the body?
Yeah. So your best way to test for it, I believe, is hair. So you see it in hair. So you can see basically heavy metals store, and a lot of heavy metals are fat soluble, so they store in fatty tissue. So unfortunately with hair, mercury doesn't show up. Well, it does, but if it's showing up in hair, you know you've got lots of it in the body. So it's not a good judge. Other heavy metals like cadmium and lead, arsenic, things like that, hair's a really good indicator of it. But mercury, no. You see the knock-on impact mercury has in the hair samples, so it knocks out things like your iron, your zinc, and your selenium, and your phosphorus. It just knocks all those levels down. So you can see, you can read into it if you know what you're looking. You can read into it and go, okay, yeah, it's high. And if you see mercury's, if you've got mercury in a hair test, you've got lots of mercury. And a lot of people have mercury because something happens.
Can I just ask a question? When you do get a fibromyalgia patient in your clinic, do you do the irises, the hair?
It depends. Hair analysis costs $105. I think it's just for the report. Some people charge $125 for the report. I don't need the report. I just want to see what's in there. So it depends on the budget of the person. I can only work within the limitations that the person sets for me. So if they don't want to do hair mineral testing or saliva testing or things like that, then I have to respect that and just work the best I can around that. But
iridology?
Iridology can be helpful. Iridology isn't, a lot of people think iridology will tell you your future and all sorts of stuff like that. It tells me more about the past. So what damage has been done, what your bloodline's like, what stock you come from, how vital the body is or how well the body can respond. But it doesn't really give us any problem. It gives me helpful information, but nothing that just goes down, that's it, that's the problem. Fibro is just too multifaceted, there's too many things going on. You need to treat lots of things. A little bit there, a little bit there, a little bit there to get that big result. But if I had a chronic disease, I'd be spending, instead of spending money on different sorts of products that you research and Google on, I'd be going, well, I want to spend my money on tests. I want to find out what I've got, so I know exactly, I can be specific about what I do. I get a lot of people come to my clinic and I list of things that big. They saw that on the internet, their friend recommended that one, and this one here said it was a miracle cure, so they're on all these things. They come in with a shopping bag full of stuff, and I was like, well, you just spent $300 here. We could have done hair mineral testing, we could have done all sorts of stuff and gained some really tangible evidence of what's going on for your body, and then we can treat you specifically. We know your mercury's up, let's get mercury up first. Then do that, have a logical plan of action to follow, rather than just trying to throw things at it. And I know what it's like. I treat a lot of cancer patients, and you get in that desperate sort of stage where you just try anything, and people will give you that and go, oh, I read this good research that says that. Research is so biased, it's not funny. Evidence-based means nothing. 50% of evidence supports it, 50% says no, it doesn't work. And it depends on who funded the evidence. You just can't trust it. You've got to look at what works. And that's why I work very closely with a doctor colleague of mine who thinks this way. He doesn't really believe in evidence-based medicine, believe it or not, being a doctor, but he just believes in what works. So he looks outside the box a bit. So things that natural medicine can do, we can look at detoxification. Any naturopath can help you with detoxification, but don't let them try to tell you that's a 6-week process. It's not. It's a way of life. You've got to do it for 6 months, a year and a half, if you want to get this out with the right sort of stuff. Nutrification, which is basically getting your diet, specific supplementation, knowing exactly what you need. pH regulation, that's systemic pH, making sure that's where it needs to be. Your body likes to be alkaline, your soil likes to be alkaline. You can't grow health in an acid soil. Grow tomatoes, fine, not health. You need alkaline soil. And that's your pH comes from what you stick in your mouth. The biggest factor is what you put in your mouth. There's other factors, but like stress influences your pH, and toxins. Restoration of the gut, really important. So likewise, pH modulation therapy, which is a nice big fancy word for getting the pHs right in the right areas. I think it's absolutely essential. And restoring those tired adrenals, which you see so often too. And to be honest, you can, if you've got a good GP, they can look at things like low dose cortisol and DHEA supplementation, or you can do it naturally and you can go with herbs and nutrients, which gives the end result. Just depends on which way you like to sit. Okay. So the final points, said it, don't expect results overnight, but they do happen. Don't associate with the disease, that's an important point. I see a lot of people associate with it, and it's important if you've got this condition to take it head on. I see there's two sorts of patients. There's the one that take their condition head on by the horns and really wrestle it and get over it. The people that consume by it, they might associate it because they perceive that they're getting something from it that they're not getting in life, whether it's attention or whatever it might be. But it's important not to associate, and really give it your best. Address your stress, really, really important. Don't blame your body, blame your soil, and your soil can be fixed. Okay? Anything's possible. Your body is the most phenomenal thing you'll ever own. Okay? Every 6-7 months, your liver's brain spanking you. Every year, your spleen's brand new. Every 3 years, your coronary arteries have completely regenerated themselves. In 7 years, your body is completely brand new. There's not one cell in your body that was there 7 years before. Now, if it's still no good in 7 years, it's because the environment, the soil, hasn't been good for it to grow back in a healthy state. So that's why I like to look at the soil. And from Dr. Thomas Rouse and the European point of view, this is called the milieu, the biological terrain, your internal environment, milieu therapy they call it. So it's treating the soil. I like to call it the soil. And remember, the more pieces of fibro that we take out, the vaguer that the disease symptom picture will be. Okay? So that's just all the references. So any questions?
Yeah, let's spell Rowden, please.
What's that, sorry?
Rowden, there's Dr. Rowden.
Dr. Rao, R-A-U.
R-A-U.
Yeah, Dr. Thomas Rao's name.
He's got a very
Paracelsus
good
Clinic in Switzerland. I believe it's very, very expensive.
He's got a very good website, and it's really
He does. He's been a doctor, and because he's got all his records, he can actually say, I can't say cure, I can't say anything like that, I get locked up. The doctor can say that because he's got the records, not that I don't have records, but it's a different kettle of fish, and he can say in 80% of MS cases, I cured in 2 years, 80% of cases, and that's one of his stats. Fibro, in 6 weeks, you can get people who feel 80% better in as short as 6 weeks when doing his treatment. But his treatment's full on. It's full on. It's 2 to 4 weeks of full on treatment. You're getting your dental work done, you get colon hydrotherapy, you're getting on a specific diet, it's life-changing if you can afford it.
But if that's in Switzerland, how do you follow it from a
There's
point of
specific
view
clinics
here in
around
Australia?
that follow up the care, the aftercare. I don't think there's one in Perth. There are over east. So that's the other tricky bit too.
I believe there's a chap called David Walcott that does some of his treatments.
David Walcott does the sound therapy. I know David very well. I'm a sound therapist as well. I follow Thomas Rao's work really closely because I
Very
just think he's...
expensive. My son goes to David Walcott.
Yeah, he's quite heavy. But the sound therapies, which are biological medicines, are very, very effective for these sort of cases. You've got to do all the other bits. It's not just those remedies that are going to do it. You've got to do the dietary stuff, the detoxification, but they can be really, really beneficial, the sound therapies.
Excuse me, is fibro related to MS?
Fibro? MS, not really. It can be, MS, there's always really, really high mercury levels in there. Mercury is a neurotoxin. It attacks your myelin sheath, which is your conduit in your nerves, which helps the nerve to conduct themselves properly. So they have things very, very similar, but MS is more of an autoimmune condition with a really big background in mercury toxicity. Yeah.
Is that a child conceived?
What's that, sorry?
I am a child conceived from a father with MS.
Okay.
Who came up on the weekend.
Yeah.
Sort of thing, yeah. The mercury, is that always, the source of that, is that always the teeth?
You take the dental amalgam is the major source. You can also get it from fish. Anything in the sea will have trace amounts. The bigger the fish, the worse it's going to be. So things like tuna, tin tuna contains quite high amounts. People don't realise tuna are massive fish. They're higher than the sea liver beasts. They eat lots of stuff. So you want to go to the small fish, so things like your sardines and the bottom of the food chain as much as possible. There's less likely to be that contamination. So if you like tin tuna, try tin salmon instead. It's a much smaller fish, like Paramount brand and Coles do Atlantic salmon, which is wild caught. Atlantic salmon tastes really yummy. It's a better option for cleaner food. But dental amalgam is your major one. It's the most toxic metal on earth. It's got no place in.
Yeah, some years ago, I said to my dentist, look, I'm concerned about mercury poisoning. Would you remove my things?
Yep.
You would do it?
Yeah, it's toxic. That's
So
why.
it was a waste of time.
It's really. There's only a few people in Australia that can do it properly with the damming and the proper ways of doing it, and it's dangerous for the dentist to do it as well. They wear masks. It's so toxic. Why are you gearing up with masks?
Most dentists wear masks for all treatment. I'm sorry, but I think that's a scurrilous comment.
What's that say?
I think that comment was
I'm not
particularly
talking about those masks. I'm
scurrilous.
talking about breathing apparatus. Actual breathing apparatus where nothing can get in if you're hooked up. That's the sort of mask that you wear for dental amalgam removal, not the typical.
That's what they call the rubber dam. When you're removing it, sorry.
Rubber dams, yeah.
Yeah, you call the rubber dam when you do remove and you do make sure that the evacuator is close to the tooth so that it absorbs. The mask worn by the dentist and the nurses just for our protection, to protect us from catching things from the patient and also spreading cross infection. But the rubber dam is very effective so that the patient doesn't swallow.
Yeah.
The
problem with heavy metals too, the vapours can go through your subcutaneous,
Yeah.
they can go through your palate, side palate.
What's
But
the
it's part of life, we're surrounded by toxins and we've got things like mercury in there. I've treated a person at the moment with mercury toxicity. She was an ex-dental nurse for 19 years, and the years when she used to handle mercury without gloves, she used to make little balls of amalgam, and her nervous system is absolutely shot. So we're going with my colleague, a medical doctor, doing some IV chelation to try and get it out of the body. Because it's really effective.
When I first started dental nursing, we used to only use a little piece of tricoat, no gloves. And they were the days that we used to wash all the instruments without gloves. Yeah, so that's just part.
And we did the best that we could with the knowledge that we had. There's so many old accepted truths that we thought were good, but now we know that we're not. We know better. We have to deal with the aftermath a little bit, and you can deal with the aftermath. Your body it's naturally built to detoxify, but sometimes when the levels of this toxic stuff in the body are just too much for it, too much of a burden, it has a little bit of a problem with it. It puts its head up and it says, "Give me a hand here." See your symptoms, starts to cry out for help.
with only having 25% of your stomach acid left? How does that impact on everything? How does that impact on from when you eat food?
Yeah, you just don't digest a huge amount. So remember that all those knock-on impacts, which is the fermentation, the lactic acid production, the alcohol production. It's just a vicious cycle. And until you break that cycle, your body stays in it. Because the big catch of that, as that food enters exits, the acidity triggers a whole heap of hormonal responses. And one of them is to stimulate the pancreas to produce a little chemical called picolinic acid. So some of you may have had vitamins or minerals in the past, like things like chromium picolinate. The reason why they do that is because they know that the pancreas produces picolinic acid, and that's how you absorb a lot of your minerals in your diet. But it's hormonally regulated, so if you've got low stomach acid, you get weak stimulation, weak absorption of things like zinc, which is one of your major factors for stomach acid production. So it's a vicious cycle. You don't absorb the stuff you need, the building blocks you need to make stomach acid, and you get trapped there, especially if you've got stress. You've always got to look underneath and go, what's driving it? My experience is usually high stress levels. It is very far beyond what our body can deal with when it comes to stress.
Does that then affect diabetes?
It can have an impact, for sure. Yeah, for sure. If there's an inflammatory sort of conditions or inflammation in the intestines, that can inflame the pancreas slightly. The pancreas is connected to the small intestine. It's going to look produce it to get out. So you can. Indirectly, it's not going to just give you things like that. Okay?
Are there any foods that are very good for increasing your stomach acid, or do you need the
Bitter food, so having a bitterness to your meals, so if you're eating salads and things like that, make sure you've got some of the bitter greens like kale or the dark red cabbages or lettuces that have that slightly bitterness. And what you dress it with, have a little bit of apple cider vinegar in your dressing just to stimulate. It's always good to stimulate digestion before you eat. The Europeans are very big into it. They're Swedish bitters and apple cider 10 minutes before meals. It just helps to get the whole process going. So when you do eat, sort of primed, ready for it, then you've got the less likelihood of that causing the fermentation and the problems.
And how do you take the vinegar?
A lot of people take it in a little bit of water. It's pretty strong stuff. You have to start pretty low. If you haven't done it before, you're like, squeeze the lemon juice, you can do it.
Mix it with honey.
So,
You can mix it with honey and warm water. And it just tastes like...
that's all right.
Yeah.
All you've got to do is get, basically the way that your stomach acid works is that there's a nerve that connects your bitter taste buds to your stomach. It's called the vagal nerve. And all you need to do is stimulate that. So if you stimulate your bitter taste buds, you've done your job. And it's best to do about 10 minutes, 15 minutes before meals, because then it gives it a bit of time to kick in. And you only need to taste it. You don't need to just keep piling it in and drink 500 mils of apple cider. Good luck. Just stimulate it and then let the body do its thing.
So it would work the same if you had something that was, had a lot of lemon juice in it?
Yeah, I quite often get people to take a good squeeze of lemon juice and a little bit of water 10 minutes before meals just to stimulate things.
No, I'm just talking about desserts or something.
Like a lemon relay or something.
Lemon juice in it.
Maybe. Gin and tonic.
I can eat a lemon, that doesn't taste bitter at all.
Yeah.
So does that mean that I'm less?
Sure, it should still stimulate it. You'd probably be able to cope with apple cider vinegar pretty well there. Right, well look, that's it. Thank you very much for having me. I hope I presented something a little bit new, or maybe a new take on something. Thank you for having me.
I'd just like to say thank you very much. We'd like to do a little gift.
Thank you.
Thank you very much for speaking today.
Thank you very much.